Hey guys. Nobody being interviewed this time. It'll just be me talking. But I wanted to do the standard Monday Ask a Massage Therapist. That means that if you have any questions for me, I am happy to answer any questions you have about massage therapy, body work. Ask a Massage Therapist is also a campaign that I'm trying to get other massage therapists to use regularly to just educate the public and talk about what it is we do as therapists. I find that the public is generally in the dark. They don't know what we do. And individual massage therapists make a huge difference in educating the public when we have a chance to talk about what we do and why. What I wanted to discuss specifically today is I developed a service I call a belly reboot. The belly reboot is taking elements of abdominal massage I've picked up over the years and looking at it from a more science-based perspective. What that means for you is if you come in and you tell me that you have low back pain, it is very likely that I'm going to do abdominal work on you. And what that means is I'm not just softening rectus abdominis, what you think of as your six-pack, your abs. What I'm doing is softening that musculature to start digging a bit deeper into what you would think of as your large intestine, small intestine, abdominal organs, smooth muscle tissue. And what happens from there is unknown. Because when I begin working on areas, I wind up in a situation where I'm putting pressure on your abdomen. It is within the tolerable range of what you can accept as far as pressure, but at the same time, it can refer pain all over people's bodies. My best guess is the reason why is because of nerves and subcutaneous nerves that are going through the abdominal area, and I'm making contact with that as I'm working on it. One of the things that began to happen was I would work on female clients in particular. It's always above their pubic bone, but I'm sinking down into areas of their belly that frankly they've never had anyone work on. And one of my clients in particular, I worked on her. She didn't particularly say anything because she wouldn't think in filling out forms, she wouldn't think to tell me she has severe menstrual cramps. There was no reason for her to tell me that. I didn't ask about it specifically because I just wasn't as trained as I am now. So as I began working on her, she said, "Oh, I have like really bad menstrual cramps." And I was like, "Oh, okay. So, tell me about that." We had a brief discussion about it, and she just jokingly said, "Listen, it feels like velociraptors want to chew their way out of my body." Now, that's important information for me because as a male therapist, I don't have a menstrual cycle. It's always going to be a little bit of a mystery to me personally when it comes to female reproductive health, but I can actually learn more from my clients when they share that information with me. That one client after one session contacted me a week later and said, "What did you do?" She was like, my menstrual cycle has never been like that. And she said, I still had a little bit of discomfort, but it was more like it was just annoying. It wasn't debilitating. I've never had a cycle that was that easy. And I was a bit taken aback because I had never really considered using the belly reboot for menstrual cramps and helping women specifically with an issue that frankly most people just don't know exists. So if you have, and when I say reproductive issues, I don't mean like the work that I do helps fertility. What I mean is if you have reproductive issues related to pelvic bowl dysfunction. You have maybe pain when you have sex. You're having some sort of pain from your abdomen, either related to your cycle. You had endometriosis. The things that I've come across in session, in addition to low back pain, chronic, ongoing, debilitating low back pain, is I've had a really high knack at being able to help women with things like severe menstrual cramps. And I'm a massage therapist. Severe menstrual cramps. I talk to women regularly who say, "Listen, when I get cramps, I take like 6 ibuprofen. I take a handful of them." Not good. My understanding, based on not being a medical professional in a sense of like a nurse or a doctor, my basic research says taking 6 ibuprofen in a sitting is not good, probably for your internal organs. You're taking too much of that, but women don't really have a lot of options. So it's really a place of honor to be in a position to help women with severe menstrual cramps, leftover endometriosis. I also see people regularly who have, for lack of a better word, they have what feels like scar tissue and some pain related to that. Now, I'm not saying that the work I do gets rid of scar tissue, but it seems to help people with pain. Hey, I'm talking. It's really good to be able to help people with that, and it's also interesting to me to be in a situation where I can educate the public about the potential benefits I can help them with. I think it's very likely that just in the Round Rock and Austin, Texas area, Gina, let me answer that in just one second. I'm sure that in the greater Round Rock and like Austin area, there are tons of women. Essentially, I could be booked out for weeks because there are people with chronic menstrual pain, menstrual cramps, other issues that I can help with. Gina, I'll tell you a quick story. There's a review on my profile. Gina was asking, does the Belly Reboot help with constipation? The work that I do is ongoing. I don't have a huge amount of research studies, and I have limited clinical experience, meaning I'm going to have more experience 10 years from now than I do now. There was a client who came to see me who was a massage therapist. She had 3 or 4 cesareans. She'd had multiple abdominal surgeries. And again, she did not tell me. I'm learning to change my intake forms to address these things, to try to get this information sooner rather than later. But what happened was this therapist, because she's a massage therapist, she was interested in my work. We had about 45 minutes left in our session, and she said, "Are you not going to do the belly work?" And I said, "Oh, are you like having issues with that?" For some reason, we had not covered that. My intake forms didn't have information about it. And she said, "Yeah, I've had chronic constipation for like 6 years." And I was completely taken aback and said, "Listen, I don't have a client after this. I have plenty of time. Let's go ahead and do that." I uncover her belly, tuck a towel into her pants, and then I use a little bit of coconut oil to do like some softening around their abdomen. I can actually post a video from Psyche Truth where I did some of this. And as we kept working, we would find areas that were tender, uncomfortable. The work can at times be intense, but I don't find it to be painful. People aren't used to someone digging into their abdomen and applying pressure through there systematically. We're not used to softening and releasing that, so it can be intense while I do it. I worked on her, and after the session, she said she felt fine. And a couple of weeks later, I got a phone call from her, and she said, "Robert, I did not tell you, but after the session I had with you, I felt like I got the flu for about 3 days." And I said, "Oh, are you okay?" And she's like, "Robert, she's like, after I had that session with you," she's like, "excuse my language, but I had like chronic diarrhea. I'm normally constipated. I had like chronic diarrhea for about 3 days. I thought something might be wrong." And she said, after that 3 days, I had normal, regular bowel movements for about at least 2 weeks. I have never, in the years, like I've had chronic constipation for years, I have never had anything that did what that session did. And she understood as a massage therapist that there was this crazy niche market. And it normalized, it helped regulate her digestion for a period of at least 2 weeks afterward. But that was just one session. That's not ongoing, regular, repeat sessions. Again, my clinical experience is limited. I'm not interested in giving people the runs, but in her case, it sounds to me like there's something going on either with her nervous system or there's actual physical obstruction of some sort that manual therapy, no surgeries, no medications, may be able to help. I'm in the process of figuring out how to package the work and to be able to teach it to therapists to add to what they are doing, because it provides this unique service that essentially you can't get anywhere else. I had to travel out of state to even get training in it because I couldn't find people who do abdominal work. To make a long story short, don't be afraid of people's abdomen. I'll share the Psyche Truth video down below so you can get an idea of how you soften someone's belly to begin with, just to start to get familiar with the area. If you watch that Psyche Truth video, you'll also notice, I believe the young lady I worked on had endometriosis. When I get into a certain area, I'm applying very little pressure. At one point, she actually reaches out her hand to stop me, because it was so intense, it was starting to cause her pain. I'm applying very little pressure, but what I'm teaching massage therapists is just soft tissue manipulation. In other words, we're just going in and working the abdomen in various ways, using hands, palms, And as we do it, I feel that it's inordinately safe. It's not extreme pressure. We're just slowly helping people become aware of an area that most massage therapists do not go into. This work is not available. When I thought about from a branding perspective, I had already formed the Reboot. The Reboot was my session that I had a conversation with a client the other day, and she was reiterating the fact that years ago when she was trying to send me clients, she had to get into these, conversations with people where it's like, he does this amazing thing, but it's on a mat. And they're like, I don't understand. I thought this was massage. The challenge was I didn't have a package to be able to give my clients that they could tell their friends and family. Well, it's a massage, but not really. It's like that didn't work. What my clients now say is, no, I don't just get a massage, I get a reboot. It's a 3-hour session on a mat. He can use full body compressions using his feet, and he does advanced abdominal work, something along those lines. That helped what I was doing stand out from massage. There was a difference now between these two services. Being able to work on people's abdomen, I can teach it to people even on a table, but it's very easy for me to perform a session. The belly reboot that's listed on my website right now is 90 minutes. I can spend 90 minutes slowly working through your abdomen, working on your diaphragm, and working on cutaneous and subcutaneous nerves in and around your digestive tract. There's really important structures in there. There's lots of questions on my end. I know that much like massage itself, it seems to work, and it seems to work for a host of maladies people do not get relief from surgeries and medications for. If people have Crohn's disease, they have irritable bowel syndrome, they have chronic menstrual pain, menstrual cramps, old issues of surgeries, leftover pain. The belly reboot seems to help people with that consistently. The reason I wanted to do the Ask a Massage Therapist today and talk about that is I want more clients for the service, and I want to be able to work with people consistently who are having chronic pain related to those issues that I can help. It is the most amazing issue, the most amazing situation to be in, to be able to work with women, to be able to help them with their GI health, to be able to help them with chronic pain related to their reproductive organs. It is not uncommon that I am working and going through slowly and putting pressure above a woman's pubic bone, and she says, I feel that in my ovaries. And I say, cool, like what does that feel like? Because I don't have ovaries. And she says, well, I can feel it. It's the same way it feels when I drop an egg, like I'm getting that same sensation. My assumption is, again, we're working cutaneous and subcutaneous nerves through that area in the same way that we would if we were working on your forearm and applying pressure and people feel pain somewhere else. The reason I talk about that both for my students and for potential clients is I want to keep working at it. And I want to keep developing the belly reboot as a service so that I can have a higher level of expertise to pass on to clients and also to my students. Peyton, when you talked about working on the lady's abdomen and working on scar tissue, I don't know that we can have that much of an effect on the scar tissue itself. So let's say a woman has had cesareans or sometimes multiple cesareans. I know that the scar tissue, binds and it has like a different physical structure than the normal tissue now. I'm not so sure that we really have much of an effect on the tissue itself as much as the nerves running through it. And, it's a normal part of a woman's process to have a menstrual cycle and to have muscles that contract because it's smooth muscle tissue. I don't have to think, hey, large intestine, work and do your job. Hey, small intestine, work and do your job. It's a different area of their nervous system. It's the how do I put that? So it's like fight or flight. I'm getting my nervous system stuff confused. But it's a part of it's a sympathetic and parasympathetic. It's a part of your nervous system you don't have to think about. It works on its own. I can think about my bicep and make it contract. I can't do that with my large intestine. So the thing is, you're accessing a different part of the nervous system, but I'm working over skeletal muscle, meaning rectus abdominis. And then I think slowly having an effect on nerves. The reason I discuss that is I want to make it clear to people that I'm still asking questions about the service and I'm still asking about what it does. If I call it abdominal massage, I think it's a loss because people think I'm working on skeletal muscle. They think I'm working on rectus abdominis. That's not really what my focus is. As I'm working, what I'm doing is I'm softening those superficial skeletal muscles to try to sink into the belly to access, in my understanding currently, is cutaneous and subcutaneous nerves that are innervating smooth muscle tissue in addition. In other words, when a woman's uterus is sloughing, I believe is what it's called, that muscle, you're not thinking to get that to happen. Your body is doing that on its own in the same way that your large and small intestine continue to move food through the alimentary canal. So, belly reboot. It's good stuff. It's also very common. I'll work on someone, they have referred pain all over their body. And I tell clients as I'm working on them, okay, as I sink into here, ooh, this feels dense and tense right here. I'll sink into it and say, listen, do you feel pain here? And they're like, no. I'm like, is it intense? And they're like, yeah, it is intense. Like I feel it where you're pressing. I'm like, are you getting sensation somewhere else? It is not uncommon. They say, I feel it in my right big toe. I feel that on the left side of my chest. I feel that deep in the shoulder joint on my right shoulder. I'm pressing in their belly, and they're feeling pain in their right shoulder. They'll ask me, why does it do that? And I'm like, I have no idea. Not in a clinically researched way. The only thing I can explain to them is my assumption is it has to do with nerves and cutaneous and subcutaneous nerves. As I'm applying pressure here, we're somehow stimulating that nerve, and it's having an effect somewhere else in their body. It's been the most amazing thing to work on people and to be able to see the experience they're having, including that in myself. And also, again, just to educate the public. Gina, so far what's in the subscription service, the Reboot Insiders Club, what's in our subscription service, if you look through, there is some private training work I do with Michael Arbuckle where we do abdominal work. There are sessions that I've recorded, one in particular with Jeremiah Reynolds that has the belly reboot in it. What I don't have is me setting up the camera and going over every little piece of detail about the belly reboot. But there are at least two that I can think of. There are at least two sessions in there. One with Jeremiah Reynolds and the full session I recorded with him. And then the other is with Michael Arbuckle and his private training where I go over some of it. Both of those, I think Michael's is probably about an hour. The one I did with Jeremiah Reynolds is probably at least 30 minutes, if I remember correctly. So as I continue developing curriculum, I have a challenge to figure out how to package the information so that therapists can pick it up and integrate it. I may eventually use the belly reboot as a standalone class and allow therapists to do it either on a table or on the mat. I prefer working on the mat, as we all know, but I'm still trying to figure out how to put it together. And I also want to be able to deliver content in a curriculum in a way that gives enough information but still asks questions. So I'm trying to do more research about what is actually going on. I can deliver the body work and I know that it works, but I'd like to be able to give students a little bit more information about the structures that we're working on and also how it's put together. Hey, Artemis. Dawn. Yeah, sloughing, I think is that, I'm glad that's what the terminology is. It makes me sound like I'm more credible, right? So anyway, if you guys live in the greater Texas area, Austin, Round Rock, and you have someone with low back pain, abdominal pain, menstrual cramps, please send them to me. I would love to work with them and be able to work on this more in clinical practice. And if you're a student, you can subscribe to the Reboot Insiders Club. I'll put a link to that down below. And there's a coupon code for $1 for your first month. There are over 75 hours of video instructional content available there. I'll go ahead and post that Psyche Truth video as well. But thank you guys so much for tuning in, and I'll go ahead and share that so that you can access that information. Thank you guys much. If you have any other questions and you're catching this after the fact, feel free to write down below. I'm happy to chat with you about it and what I see, but it's really a pleasure and an honor to be able to work with clients to help them with their belly health. It's really nice to particularly in my experience, work with women on reproductive related issues that I never really thought would be part of my practice as a massage therapist. Thank you guys so much, and I'll include those links below. From Germany? How do I get... Well, I mean, we can fly them in if we had clients from Germany. Otherwise, being able to give them information, Montaken. If you're a massage therapist, you can subscribe if your English is good enough. You can subscribe to the subscription service and get information there. Even if you're not a therapist, you can still use that content and information and learn how to work on them. It's a start. So I'll talk to you guys soon, and you have a great Monday. Thank you so much for joining in on this Ask a Massage Therapist.